One common question that we get asked a lot about in terms of skin pigmentation related issues is, do I have melasma? Melasma is really a stubborn hyperpigmentation or browning that almost looks like a patchy distribution in the skin. Unfortunately, it is a very challenging thing to treat, and it is not an uncommon thing, so we see it a lot. It's something that can be exacerbated, or you can get it as a result of things that are out of your control to a degree. Hormones, for example, sun exposure, and certainly, some people are maybe genetically predispositioned to getting it more than others. But it's a very stubborn thing, and unfortunately, it does tend to be something that people deal with on a regular basis or for a long period of time. Things and options that we have to help with that, in addition to things that are good for general principles and practices, patients with melasma, sunscreen use, but we have a number of different lasers that we have in terms of options to treat that. Other things that are really effective and have a lot of evidence to support effectiveness in terms of making it better would be, in addition to sunscreen, would be a retinol use and something called hydroquinone. Hydroquinone is a topical medication that can actually reduce some of the pigment producing cell activity in your skin. So that's an option. And then for those that still need additional treatment, or those that want to be a little bit more aggressive in terms of correction, we do have a number of different lasers for different skin types that really allow us to help and improve that. PicoSure is one of those, as well as Moxie, which is a relatively newer laser, safer for all skin types. I will say melasma, though, is something, that tends to be something that can linger even after treatments, and it can come back, particularly if your sun exposure is still problematic. And so sun protection tends to be something that's really important. But it is a challenging issue. We do have options to make it better. So I think, we can have a conversation and kind of dive into those things for you if that's an issue for you.